Thank you to the organizers for inviting me to speak on the roles of pharmacists. And here I'm talking about the roles of pharmacists in enhancing diabetes care for people who fast during Ramadan. Challenges faced while fasting during Ramadan goes beyond just the disease and medications. So while we are concerned about potential glycemic fluctuations resulting in risk of hypoglycemia and hyperglycemia, other complications such as dehydration and thrombosis, inappropriate medication used while fasting during Ramadan can also pose significant risks. Challenges also extend to the lifestyle aspect. Not only disruptions to sleep pattern, diet, and physical activities, but also the need to frequently self-monitor blood glucose levels. These challenges can be more pronounced in Muslim minority countries and territories. Several studies have reported that Muslims perceive healthcare providers in some of these Muslim minority countries as not understanding their needs and culture, and hence many were reluctant to seek advice and education from their healthcare providers. However, some of these challenges can be addressed by bringing in pharmacists to the picture. Now, I will highlight three key areas that pharmacists can play a vital role in to address some of the challenges that I have described. Number one, being involved in medication management as part of an interprofessional, person-centric care team. Number two, providing education and lifestyle counseling. And number three, serving as knowledge and information hub. In terms of medication management, pharmacists can play a collaborative role as part of an entire healthcare team, which anchors on shared decision-making with the physician and patient to develop a medication action plan. And the provision of education, as well as serving as an information hub, forms a safety net in the community. Subsequently, in my speech, I will highlight the roles of community pharmacists, specifically in this aspect. So to appreciate the roles of pharmacists today, let me first share briefly the transformation of the pharmacy profession. The pharmacy profession has transformed from a product-based profession to a service-centered profession today. In the early 1900s, pharmacists were engaged in compounding and dispensing of medications based on prescription. The role of pharmacists mainly revolves around dispensing all the way till the 1980s, when pharmacists began to play an active role in patient counseling. This was the pharmaceutical era, when pharmacists were seen as healthcare professionals, taking care of patients' health, involved in medication and disease management. Today, the roles of pharmacists have further evolved. Pharmacist is being seen as an integral part of the healthcare team, working collaboratively with the primary care team, providing services aimed at promoting health, behavioral changes, lifestyle, and medication management. So, the healthcare paradigm has essentially shifted from the physician-centric model to the interprofessional, person-centric care model, involving physicians, pharmacists, nurses, dietitians, other healthcare professionals, and stakeholders. And this care model anchored on shared decision-making, respecting the patient's individual needs, beliefs, and culture. And in the interprofessional care paradigm, pharmacists are well positioned to complement the healthcare team in medication management, including review, reconciliation, and recommendations for adjustments of doses during Ramadan. Pharmacists, together with physician and the patient, can develop a medication action plan to guide the appropriate adjustments throughout the month of Ramadan. So now, let me share a few studies on the impact of involving pharmacists as part of a collaborative care team. A recent cohort study conducted in Saudi Arabia has in fact found promising outcomes of a virtual collaborative care clinic in which pharmacists were involved in managing medications and counseling. In this study, the general characteristics of the participants were similar to many reported trials conducted among people with diabetes. The collaborative care involving lifestyle management, education, laboratory testing, coupled with pharmacist involvement in medication review and management, led to a significant improvement in glycemic control over 4 months. While this study was not specifically conducted among Muslims who fast during Ramadan, but the positive outcomes highlighted the potential of the roles of pharmacists and medication review being conducted via telepharmacy. So this further enhanced the evidence that pharmacist-involved collaborative care can be effective in managing diabetes for people who fast during Ramadan. My team also conducted a 6-month randomized controlled trial to evaluate the impact of community pharmacist-involved collaborative care model in diabetes management. In this trial, the pharmacists prepared an individualized medication action plan together with the patient and physician. So the medication action plan, in short abbreviated MAP, allowed the pharmacists to make recommendations that were specific to the patient's disease control, medication-related problems, and develop non-pharmacological plans with a focus on self-care together with the physician and patient. The MAP encouraged holistic documentation of patient care, which also allowed the care team to communicate and endorse care plans jointly. And the community pharmacist also focused on diabetes self-management and education, including glucose meter teaching, setting of individualized goals, and interpretation of blood glucose results. So all in all, we found that the mean improvement in HbA1c level was significantly greater between the intervention and control groups over 6 months. Similarly, diabetes-specific quality of life and self-care capabilities also improved significantly. The second aspect to ensuring safe fasting during Ramadan is to form a safety net in the community. The DAR Global Survey found that most people with diabetes intend to fast during Ramadan, and many of whom are residing in the community. Hence, it is important to engage our community healthcare providers, and in the context of this talk, I'm referring to community pharmacists. Community pharmacists are often the first port of call for many community-dwelling individuals with diabetes and chronic diseases. They are easily accessible, and in many countries and territories, community pharmacists are a trusted source of health information that the public can turn to. Therefore, they play a central role in providing education and to reinforce Ramadan-focused education. On top of that, community pharmacy can also serve as a knowledge and information hub. The DAR International Alliance Practical Guidelines has emphasized on the importance of Ramadan-focused education, from risk quantification, addressing of misconceptions, lifestyle modifications, medication adjustments to hypo and hyperglycemia management. Pharmacists can build strong rapport with patients and serve as an avenue to reinforce these educational points and empowering patients to fast safely during Ramadan. In fact, there were several studies, specifically randomized controlled trials, that showed positive outcomes of pharmacist educational intervention on glycemic control, blood pressure, lipids, and diabetes knowledge. Furthermore, the roles of pharmacists around the world have also evolved and transformed to one that focused on patient care and health management. The frequent engagements of community pharmacists were also found to improve mental well-being. In a cohort study that we have conducted in Singapore, we found that health education not only improved glycemic control, but also mental well-being. And this evidence further supports the importance of engaging our pharmacists in caring for people who fast during Ramadan. Another aspect that community pharmacists can play a critical role in is to serve as a knowledge and information hub, not only as an avenue for patients to seek knowledge on health and medications, but also to promote accurate information. With the advent of technology and rise of social media, there are a lot of information easily accessible by the public. Therefore, community pharmacists can be a go-to reliable source for education and information. With this, I have highlighted 3 key areas that pharmacists are needed as part of the healthcare team in managing diabetes for people who fast during Ramadan. But I would also want to highlight that research involving pharmacy and pharmacists in managing diabetes for people who fast during Ramadan remains extremely scarce, especially in Muslim minority countries and territories. In order to advance diabetes care, especially for people who fast during Ramadan, research is vital. We need to assess the roles of pharmacists in managing diabetes for people who fast during Ramadan, the outcomes of pharmaceutical care services, exploring and assessing patients' perceptions and acceptance, as well as identifying enablers and barriers to implementation. This is especially so in Muslim minority areas, where some studies have already reported that people have the perception that their healthcare providers do not understand their specific cultural needs. There have also been studies reported pharmacists lacking knowledge with regards to diabetes management during Ramadan too. But research to address these deficits remain limited. So here, I'm calling for more research in this domain so as to further transform the role of pharmacists and to enhance diabetes care. Beyond research, targeted training for healthcare professionals and pharmacists to manage diabetes for people who fast during Ramadan is also critical. So one example of such training was developed by the DAR, the Train the Trainer workshop. So DAR Southeast Asia had the Train the Trainer workshop conducted in December last year in Malaysia, where physicians, pharmacists, nurses, dietitians, and other healthcare professionals gathered to receive specific training on how to manage diabetes for people who fast during Ramadan. This type of training is exceptionally useful in equipping healthcare providers and pharmacists with the relevant knowledge and skills. All in all, I have emphasized that pharmacists can play a value-added role as part of an interprofessional care team in managing medications, providing lifestyle counseling and education, and promoting optimal diabetes care during Ramadan. And in order to continuously enhance diabetes care in this domain, research and training are extremely essential. With this, let me end off with this quote. He who has health has hope, and he who has hope has everything. Thank you.